Let's talk about Health Information Exchange. This was a initiative back in 2010, the American Recovery and Reinvestment Act, to try to provide grants to states to establish a health information exchange in their state. It was initially thought that we could get like hospitals and labs and physician practices to all contribute information into a central sort of cloud of information so that it could also be accessed by different entities. The future held other sources such as patients and health plans. So one of the thoughts was if I went and saw a doctor in Bangor, Maine, and then later that evening I ended up in the emergency department 2 hours away in Portland, Maine, and that the emergency department in Portland, Maine could look and see what kind of lab tests and what kind of visit I had in Bangor, Maine. Even the basic information such as allergies would save a lot of time in some cases, particularly if I arrived at the emergency department unable to speak. So that was part of it, was to try to get these states to build these exchanges. Now, many states have been very, very successful. There are some states that were not able to make this sustainable once the grant money ran out. But this is really important because now we're starting to exchange information and be able to use that information to help not only take better care of patients, but we can reduce costs by not repeating all those silly labs and x-rays that often get repeated if you don't have the answer. So in the past, when we had to exchange information, as you see on the left, it used to be, the medications, the pharmacy had the medication and they had to communicate with a multitude of hospitals and providers and patients and physicians in order to make that happen. And so there was like this kind of spider web of lots of communication, a lot of the same communication going on between many of these entities. On the right hand side, if we have all these entities contributing to a central hub of information, and then we could all sample information out of that central hub, it's way more efficient. We can have better standards. In the spider diagram, everybody had different requirements for what their data needed to come in looking like, and what these are often called are file specifications. None of them are the same. Every time you wanted to give information to other entities, you'd have to get some programmer to make that file specification. So in a lot of ways, having this central repository for this information has standardized it in a way that more information can come in a more efficient manner. So here are some of the benefits. In my example, we have the information flow at the right place and the right time. So the ED can tell if you have an allergy. If you go visit another doctor in the state, you can see that doctor can see what happened at a previous visit. So that makes for seamless transitions in care, and it kind of helps do that by saving everybody time, not having to re-ask and retell a lot of information, although that still happens to a certain point. We can start to build trust in some of the information that's been inputted. Improvements in quality and lowering the cost of patient care. Like I said, not repeating diagnostic tests would be a big one right here, and that would be great. That would save us all money. Here is so in Maine we have Health InfoNet, and it's been pretty successful with information access. This is actually some information that's a few months old. They are, they received 549,000 clinical messages. 348 people have access to HIE. It may not sound like a lot, but we're not, Maine's not a huge state. We have in Maine, they have used the opt-out plan. So when it was first being implemented, you could opt out if you didn't want your information going to that. So that yields a higher number of participants in the program. In other states, when they've done an opt-in program, they have significantly less participants. So you can see the kind of usage: patient accesses, notification, public health transmissions, and so it's pretty impressive, the amount of numbers. There's only 1.6 million Maine residents, so it does provide a great deal of information. One of the hardest things for HIEs was to become financially sustainable after the grant went away. And one of the things Health InfoNet does is they sell some of their information. They have an analytic portion of their organization now in which they allow you to be able to mine the data. Typically it's de-identified. These are mostly statistics. Many of the HIEs have joined SHIAC, and this is a national collaborative that is representing health information exchanges. So they have quite a few health information exchanges participating. Now there are some states that have more than one HIE in their state. That can be good or bad. That sometimes causes issues because there's no single organization and they seem to compete with each other, which isn't always good. The other thing that is interesting, in Maine, they don't let the health insurance companies use any of the information that is gathered, which is quite unfortunate. In Michigan, which has a very, very healthy HIE called MyHIN, they have actually partnered both with provider organizations and with the payers, and they provide really healthy feeds. And they're in the Michigan HIE, one of the ways they're financially sustaining their organization is they actually charge organizations like payers to get those feeds, which are really valuable because it augments the claims information so that they can report quality measures to their national organization. So I think that's really important. So that's a little bit about HIEs. Wherever you are, you might want to reach out and see if there is one. I provided some videos in the course to show you a couple of very successful ones. Thank you.